Hello, my name is Vicki Ribsam. I am the Joint Replacement Nurse Navigator here at Concord Orthopaedics. In this module, we will review preparing to be home. So how to transition from the hospital or your outpatient surgery center to home after joint replacement surgery. So when will I leave the hospital? And that's a hospital-specific question. Most patients spend one night in the hospital. Some people do well and they feel good after surgery, and they do some physical therapy with a physical therapist where they practice stairs and getting in and out of bed and in and out of a chair and walking in the hall, and they feel safe to go home. They also are medically stable, meaning their blood pressure is good and their heart rate's good and they're breathing well and they have very well controlled pain. In that case, you might want to even go home the same day from the surgery. Certainly, if you are having surgery in an outpatient surgery center, one of our orthopedic surgery centers, you would go home the same day. You'd have surgery in the morning and again practice with therapy. And when you're medically stable, you go home. But most patients who have surgery in the hospital spend one night in the hospital. And that's really to allow time for you to recover and do your physical therapy and then go home the day after surgery. Sometimes if you need a little more time to practice with therapy, or you need a little more time to become medically stable, meaning to get your blood pressure, heart rate, or pain under control, then you would spend 2 nights in the hospital. But again, most of our patients spend one night in the hospital, and a good portion of patients spend no nights in the hospital. One of the things to think about when you're leaving the hospital is that you need to have help at home to be safe to go home. You don't necessarily have to have somebody live with you, but you have to have a plan in place so that there's somebody that you can count on if you need help that you can call that could be there right away. Safety at home is very important, so it's important to have identified a coach or somebody who can help you recover when you get to your home. So preventing falls. Falls can be very dangerous after surgery. It can damage the hip or knee that might need more surgical repair. It can create a lot more pain than you really need to have. So preventing falls is very important. Start to walk around your house and notice the things that you are stepping over or might be in your pathway for when you get home from the hospital. Typical things that people have to move are throw rugs, electrical cords, anything that might be piled up in your pathway. It's a good idea to move it. It's likely you'll be using a walker after surgery. Walkers are a little bit wider, so you do have to make sure that you've cleared a wide pathway around your house. Stairs, walkways should all be clear. Make sure your shower doesn't become slippery when you're showering. Often people buy the sticky grips, which they can apply to the bottom of the tub so that they don't find the tub slippery. And I know I just told you to remove throw rugs, but now I'm going to say that you probably need something to step onto when you get out of the shower, just so that you don't have a risk of slipping on a wet surface. So no throw rugs except for that one circumstance when you're stepping out of a shower. Keep frequently used items within reach. It's going to be difficult for you to reach things on a very low shelf or a very tall shelf. So things that you might want to consider, food or eating utensils, any items that you might use in a bathroom, personal hygiene items. Just start to pay attention to the things that are kept a little bit out of reach so that you can move them to the counters so you'll be more comfortable after surgery. Make sure you have a cordless or cell phone that you can carry with you, and make sure you have a way to carry it around. So you might have a bathrobe or an indoor jacket or sweatshirt that has a pocket, and those are great ways to transport your phone. You should not be up and walking around or sitting anywhere where you don't have access to a cordless or cell phone in case you need help. Make sure your cell phone is charged, or if you need an extra charger, now's the time to go get it. Make sure your pets are cared for. Make sure that somebody else is going to be responsible for walking, feeding, or changing kitty litter. It's easy for pets to get underfoot, so you have to have a plan for how you're going to manage them when they're happy to see you come home. Make sure you have night lights. One of the easiest ways to trip and fall after surgery is from your bed to the bathroom at night. So do you have a plan where you can have a lamp next to your bed, something to turn on when you get out of bed that will illuminate your pathway? Is it a good idea to hop over to Bed Bath & Beyond or Amazon.com and get some night lights to light your path from your bed to your bathroom at night? Make sure you have handrails in the bathroom and on stairs. So it's important to have something to hold on to when you're stepping into a shower or maybe sitting on a toilet. The sticky handrails, suction cup handrails, are not terribly reliable. Sometimes they cause falls instead of helping prevent them. So I do recommend sturdier handrails, things that are actually mounted into the walls. How can I make life easier at home during recovery? Well, have a coach that's with you to help you remember instructions and think through challenges. Make sure your coach is watching these videos and helping you think about the ways that you're going to make life easier at home. They're the ones who are going to be remembering what was said and what was done when you took your medicine, when you need it next. So make sure you have somebody that's going to be with you throughout this process. Find a comfortable chair to sit in. If you find a very low chair, they are hard to get into and hard to get out of. So find something that keeps your legs at a 90-degree angle or higher. Also, make sure that your chair allows you to elevate your legs. Recliners are a fine idea. Some people like to sit in a chair with a footstool or an ottoman in front of them. Most of the time when you're elevating, you don't need to have your feet far off of the floor, just off of the floor. So find somewhere comfortable for you to sit. Find somewhere where you're going to have a good time during the day, somewhere where you can prop your feet up, have a nap, put some ice on, relax. It's important to find a good chair. Prepare meals in advance. You are not going to be able to stand for more than 5 to 10 minutes after surgery. That's going to feel like a long time that first week. So it's a good idea to find things to eat that are quick and easy. Salads, yogurts, things that you can put in the microwave quickly. Lots of people freeze meals ahead of time. Depends on how good of a cook your coach is. But make sure you have something available to eat quickly so that you don't have to stand and cook for any length of time. Do laundry before surgery and find loose-fitting, comfortable clothes. So now is the time to look in the back of the closet for those old sweatpants that were too big for you a while ago. Those are the ones that you'd want to wear now. You are going to have some swelling after surgery, so it's a good idea to have something that's loose-fitting that you can slide up over your leg. That's going to make things more comfortable for you. Nothing too tight, and nothing you can't roll up if you need to see your incision on your knee, and nothing you can't pull down if you need to see your incision on your hip. Buttons and zippers are not a great idea at this time. Do laundry before surgery. So clean sheets, clean towels. Make sure that everything is all set for you to come home to a nice clean environment. Make ice ahead of time. So you're going to be using a lot of ice to cool your incision. It's important to have that ice available. If you have an ice maker, make sure it's in good working order. If you don't, you might want to stop at the convenience store for a nice big bag of ice to put in the freezer ahead of time. For any questions or more information, please call or email me. I am the Nurse Navigator. Again, my name is Vicki. That is my email, Vicki Ribsam, vicki.ribsam@concordortho.com or 603-724-2353.